5210. Every kid, every day. Let's have fun the healthy way. 1, 2, 3, 4, 5 servings of fruit and veggies are great to eat. 1, 2 hours of playtime or less on our screens is more than plenty. And let's go play outside. 1 hour! Tiger it, my turn to hide. 0 sugary drinks. Yeah, that's the healthy way to think. Every kid, every day. Let's have fun the healthy way. Every kid, every day. Let's have fun the healthy way. 5210.
All right, I would like to welcome everyone to session A of episode 9 of Project Echo for Pediatric Obesity. I'm Jessie Kreiner and I'm with Keys for Healthy Kids. Today's episode is entitled Practical Motivational Interviewing Strategies. If you're joining us live today, please introduce yourself briefly in the chat and include your name, email address, title, and whether or not you want CME credit. You can also use the chat box to ask questions throughout the session. Again, we need your first and last name, your email address, and whether or not you want CME credit. All right, and with that, I'm going to go ahead and turn it over to our host with the most, Marinda.
Hello, everyone. I'm really happy to see you, and I'm really happy we have Dr. Chris Bolling today with us, who I'm going to introduce in a little bit. But first, I just want to go over the objectives for this session. So by the end of this session, participants will be able to explain how motivational interviewing is used to bring about behavior change. And then number 2, describe how motivational interviewing complements other commonly used health behavior tools in clinical settings. And number 2,
sorry about that. That was on me.
Number 3, use 2 motivational interviewing tools in a clinical setting. So before we introduce Dr. Bolling, we're going to do a couple of poll questions. So Jessie, if you can go ahead and do the first poll.
Of course. All right, it should be visible now to our participants. What is your comfort level with motivational interviewing? Ooh, we look like we're very in the middle right now so far. We have 10 of 20 participated so far, 11 of 20. All right. Looks like we have a lot of room for learning.
All right, you can go ahead and end the poll, Jessie.
Okay, and then everybody should be able to see the results.
Yes. So it's 67% somewhat comfortable, 27% very comfortable, and 7% not comfortable. And we're going to do a second poll.
All right, moving right along. And our second question is, how often do you use motivational interviewing with challenging patients? Never, some of the time, most of the time, or all of the time? I feel like I should do the Jeopardy music in the background, but if I play the actual Jeopardy music, we'll get copyrighted. So you're just going to have to listen to me sing it.
We could do 5210 in the background when we do polls. 5210.
All right, we have 14 of 22 respondents. Come on, y'all, let me hear what you think. How often are you using motivational interviewing with your challenging patients?
All right, so we have 40% that said some, oh, actually, okay, still going. Yeah. 44% some of the time, 25% most of the time, and never, and 6% all of the time. Definitely room for improvement. All right, Jessie, you can go ahead and close out the poll.
Of course.
Thank you. And I'm going to introduce Dr. Bolling. So we're really pleased to have Dr. Christopher Bolling. He is a pediatrician and founding partner at Pediatric Associates in Crestview Hills, Kentucky. He's a volunteer professor of pediatrics in the Division of General and Community Pediatrics at Cincinnati Children's Hospital Medical Center and the University of Cincinnati College of Medicine. Dr. Bolling served as the chair of the Executive Committee for the American Academy of Pediatrics section on obesity through 2019 and is Obesity Task Force Chair for the Kentucky chapter of the American Academy of Pediatrics. He is published in behavioral and primary care pediatrics, and he serves as a consultant in matters related to obesity prevention, motivational interviewing, community-based participatory research, quality improvements, public policy, and practice-based research. He also speaks on and trains providers in public advocacy and has extensive experience in early childhood obesity prevention in the medical home and childcare settings. We're very happy to have you today, Dr. Bolling.
It is my pleasure. It's my pleasure. I also got just a fun message there from Amy that I didn't realize she was going to be in the audience there. She's a former parent in our practice. So that's pretty cool. So hi, Amy. That's very cool.
That's wonderful.
So as you know, I am a general pediatrician first and foremost. My practice is in the Kentucky suburbs of Cincinnati. I was just saying to Jesse as we were getting started, I said there's a lot of similarities between practicing in Kentucky and practicing in West Virginia. And I don't know that the rest of the country, maybe Southern Ohio understands us and East Tennessee understands us a little bit, but we're our own beast, I think. Yeah, it's great to be here.
Yeah, so with that, I'm really excited. So we're going to be talking all about motivational interviewing. So I thought, Dr. Bolling, we would just start off with you talking about what motivational interviewing is. So can you talk about that?
Sure. There's sort of a formal definition of it. You know, I think if when you look it up, you always say like, okay, it is a patient-centered counseling technique that, you know, we talk about. It has sort of three characteristics to it. It respects patient autonomy. So it kind of gets us out of this role immediately when we think of the definition of being prescriptive. So it's really being more respecting the patient's autonomy. It's about a big characteristic of it. It's really about eliciting the patient's own motivation to change. So the second characteristic of it is that we're trying to trigger using the patient's own values to make their case for behavior change, which is a little different than some other counseling techniques. And then the third characteristic of it is it's always collaborative. And I think that's something that we as pediatric medical providers are pretty good at. So that's sort of the official definition of it. I also think that, you know, over the years, I've gotten to think about it. And I know Dr. Hassink has talked with you guys before too. She's always said, you know, this is really sort of the why. And I think that's true. I think we get into trouble sometimes with it when we try to make it more than that. But it's really the why of behavior change is what you're working at when you're talking about motivational interviewing. There's definitely part of the how, like how are we going to bring about these changes? But again, those are about, you know, why use this strategy versus another. So there's sort of this formal definition, and I like to think of it, like I say, as the why for behavior change.
Okay, great. Thank you, Dr. Bolling. And I think it's great because it kind of goes against what we've been taught. You know, we're very used to telling patients what they should and shouldn't do. And motivational interviewing really is very different, where it actually puts it in the patient's court. And so,
you know, and I think too, Miranda, it's really been, for those of us who use it a lot, and I think general pediatricians, we use it a lot, it's been a game changer for me. I kind of had this mid-career moment where I went back into pediatric obesity training. It's where I really feel like I learned how to do motivational interviewing. And when I went back to my practice after that sort of mid-career training, it has really personally changed the way I practice medicine, and I use it all the time. It's kind of freeing, honestly.
Great. All right. So can you tell us about the processes that go into motivational interviewing?
Yeah, you know, I think we can talk about the definition, but I like to think about it. The last edition of Miller and Rolnick's book on motivational interviewing, which is a great book, by the way. The third edition of that really talked about, instead of thinking about it as a definition, thinking about it a way of processes. And there's sort of a sequential process. The first process we talk about when you're doing motivational interviewing is what we call the engagement phase, where you're really taking that time to kind of pause at the very beginning of a relationship to kind of get to know your family, And this is sometimes with motivational interview, I think we're just giving names to good habits. But that moment, giving a name to that moment where you're really beginning to ally yourself with a family and a patient is really important if you're going to be effective at all and bring about behavior change. The second piece of it is the focusing phase. And, I think some people think that motivational interviewing is this very free form. For those of you who remember from psychology, the Rogerian thing where you're sort of like, letting the patient take you where you want them to go. Motivational interviewing is directive. It really is very much like you have something that you see that, a bad behavior or a harmful behavior that you really want to help this patient with. If they're smoking 3 packs a day, the goal is to get them to smoke less or to quit altogether. So it's directive. It's not dictatorial, but there is directive and there's a focusing. So this focusing and picking a proper behavioral target with a lot of patient input is very important. The third step, the third phase is the evocation phase, where we're doing a thing where I mentioned in the definition, where you're really trying to explore what motivates that patient and how you're going to use their own internal priorities to bring about a behavior change. So it's really, rather than like us going, you need to do this, you need to do this, you need to do this. It's really trying to figure out like, what's going to speak to this family? How am I going to get, this teenager to think that this is a good idea to do this? And then the fourth phase is the planning phase. And again, even though it's about a plan, it's done in a very collaborative way. So this is moving a little bit from the why to the how, but you're still really doing it in a collaborative way. Like we're picking a nutrition plan that you both can agree on, or we're doing an exercise plan that is effective for them and is doable. So those are the four phases that we talk about. There's it's engagement, taking time to do that. It's focusing, it's evocation, and it's planning.
Well, yeah, and that's nice that it breaks it down. So then you can it's easier to
use. It's a good reminder too, Miranda. It's a good reminder to go like, don't jump to the planning phase. That's phase 4. And I'm always, like 15 minutes, I got to get in there. I got to get in the plan. I got to write it down. I got to get out of here. So it's really taking the time with those first 3.
Right. So can you talk about how we can use it in the clinical setting?
So I think using it, I always like the phrase that it's a tool. You don't use a hammer for everything, but you use it when you need to use it. If you're getting the common complaint with it, when you first have learners with motivational interviewing is like, this is going to take too much time. It's going to take too much time. Well, my argument is always like, it takes less time to do something that's going to be effective, even if you have to do it over multiple sessions. So it's a tool. You're not going to use it when you're taking a surgical history. You don't need to ask an open-ended question if you still have your appendix in. There are a lot of questions that are yes, no questions, and they should be yes, no questions. So you're using it when you're talking about behavior change, and that's really the limitations with it. And it's also got limitations in the sense that I think it's really not very helpful with patients with eating disorders. I think they're sort of a different story. They really are tough. It's really tough with patients who have active psychosis. This is not a technique that we're trained enough to use it for patients who are really complicated from a behavioral perspective. I would even, I don't know if you guys have felt this way too, but I have been really, I don't know if this is, maybe I'm just cynical at this point, or hopefully it's just sarcastic and not cynical, but some of the programs where they've said like, oh, you need to use motivational interviewing to help with your anti-vaxxers. I'm like, really? I just think that's really, really hard with some people that are really, I just think it's not, you're working for it with the movable middle. And it's going to be difficult to do everything. You're going to get some people moving who you really thought you could never get moving. I'm not don't want to shortchange it, but it's also, we're not psychiatrists. And we're going to need to know when things are sort of beyond its capability. But I think it finds really good utility in a lot of different settings. I always am telling learners, do not wait for a patient with weight issues to use motivational interviewing. You want to use it in all sorts of settings so you become comfortable with it.
That's very good. Yeah, that's a good point to point out, that it isn't always just dealing with patients that have weight issues. It's also can be used with vaping, with which we're going to show you in a little bit. But yeah, so there are multiple avenues that you can use it with.
I'm a general pediatrician, so the most of the time that I use it, I'm using it with, a lot of other settings. I'm using it more with I am using it with well, do you really want to do here? Let's talk about an alternate vaccine schedule. Let's talk about you're taking your ADHD medications. Let's talk about safe sex with our adolescents. We're talking about those kinds of issues, and I'm definitely using motivational interviewing in those settings as well.
Perfect. All right. So I heard you developed a motivational interviewing manual. Can you tell us about that?
So this is nothing fancy. I'm going to go ahead and share my screen here and bring it up. You guys should all have this.
And we will have it available. I'll
Good,
email it to everybody.
And so what this is just, it's almost more just a cheat sheet. We're going to go over some things here. It just has some of the stuff that we talked about, like the definition, the 4 processes, talks a little bit about some open questions. I think we all know open questions, and we're always good at practicing those. But the goal I always feel with motivational interviewing is getting past those open questions and getting into the meat of it, which is really reflective statements. So we talk a little bit, talks a little bit about the types of reflections, just not so much that you have to always parse out, oh, I'm going to use this type of a reflection. It's just, I think it's helpful. Names are helpful when we're thinking about how we're reflecting things, what we're reflecting in a reflective statement. It's just got some tips that I found useful over the years. Then we also talk a little bit about the readiness ruler. We're going to hopefully do some examples of the readiness ruler. We're not going to do the value sheet today, but I put some stuff in there about discussing values. And then we also have a section in here on elicit, provide, elicit, which I think is a really, really important technique, and one of the more advanced MI techniques that I think are really, really helpful to become comfortable with. So there's nothing proprietary about this. Feel free to copy it, share it, do whatever you want with it. It's not copyrighted. It's just basically a cheat sheet, and feel free to use it as you would like.
So now we're actually going to practice motivational interviewing. So Dr. Bolling has some cases that we're going to do.
So Miranda is going to be the first patient. Pay attention to how she does this. We would love one of you to be the patient in the next setup. Okay. So case 1 is a 17-year-old who has severe obesity. She also has early onset type 2 diabetes, has non-alcoholic fatty liver disease by lab values, but she does not see weight as a cause for her medical problems. So we're going to try a couple things here, and Miranda is going to be the patient. I'm going to be the provider or the counselor, however you want to call me. And we're just going to have a little bit of a motivational interviewing based sort of discussion. So we'll start off. So Miranda, thanks very much for coming into clinic today. It's good to see you.
Thank you. I'm really happy to be here.
So Miranda, we're going to kind of just dive right in. I know we talked about a lot of things last time since you were in here, and we were discussing a little bit about getting the blood work. I'm really glad you got that done. Thank you.
You're welcome.
So, some of the things that I got back, we got some stuff back on your blood work that is a little bit of a concern to me. There were some things that came back actually, and I know we've been following blood sugars with you for a little while. It looks like blood sugars are getting a little bit, have become a bit higher with you. And there's also this level called an hemoglobin A1C that's a little bit higher as well than we like to see. And also I noticed too that there is a little bit of elevation in your liver function, which sometimes we'll see too when there's some liver injury. But before I start diving in, what are your questions? What are your thoughts about these things that I'm saying?
So, I'm not really concerned. I just, it's just, I've been this way, and I just think, my family's this way. I just don't really think that it's kind of just how we're going to be, and it's normal.
So you're feeling like, so when I say things like, like I'm worried about diabetes or worried about liver injury, you're kind of feeling like that's like, you're just sort of, that's going to happen to you.
Yeah, that's just how it is with my family in West Virginia. That's just how we are.
Uh-huh. So are there does that cause you any worry?
No, not really. No.
So what I'm hearing you say is that you're feeling like there's really nothing that you can do about this.
No, I don't think there is. I think
Okay.
it's just something that I have to deal with.
Okay. What are your thoughts on how to deal with it?
You broke up just for a second.
So you're
What are
saying
my thoughts? I heard thoughts.
you said that you're just going to have to deal with it. What does that mean for you? What does dealing with it mean for you?
So I guess that means I just continue to do what I'm doing, eat what I want, and it's not really going to affect my health, so it doesn't matter.
So your understanding with the type 2 diabetes and the liver disease is that it's not going to affect your health.
No. Yeah,
Okay.
I don't really think so.
Okay. Would it be okay if I shared some of my thoughts on the diabetes part of it?
Yeah.
Okay.
You can share.
So what we do know is that when you get diabetes early, it can cause problems over a long time. You may not see anything early on, but the longer you have it, the more time it can cause problems for you. So like, might not be a problem right away, but if your blood sugars are elevated for a long period of time, it can start causing health problems. What are your thoughts on that?
Well, that scares me a little bit because honestly, I feel fine. So thinking about causing problems, like I just haven't really thought about it because I feel okay. But
So would it be possible if I gave you another little thought on that I'd like to get your response to?
yeah.
So, one of the things I was concerned about was that you were feeling like, okay, this is the way my family is, that there's nothing I can do about this. So why worry about it if it's just going to be the way I am? One of the things that we know is that people who can kind of interrupt weight gain or even lose some weight can actually control type 2 diabetes in a lot of ways, and that there are therapies that we can interrupt the process of type 2 diabetes. Were you aware of those things? Did you know that?
No, I wasn't.
Okay.
It's actually really good.
So what you're saying is that would be something that would be good if we could interrupt it, if that was possible.
Yeah, definitely. Because my grandma, she had to have a toe amputation because of her diabetes. So I don't want that.
Yeah, that sounds like your grandma's experience with it is not something that you're interested in.
No.
It also sounds like that it makes you, it's a little bit fearful. You sound a little fearful when you talk about that.
Yeah, definitely.
All right. Okay, so let's stop it right there. How about some observations in there? Anybody have any observations or questions about how that interaction went?
I think Miranda was rough on you.
Oh, but she gave me some stuff to go with. I thought she
I know, but
I thought she was pretty accurate though. I thought she did a good job.
Yeah, I mean, she
Very
just sort of seemed
realistic.
apathetic about the whole situation at the beginning
Mm-hmm.
and uninterested.
Mm-hmm. Which I think is pretty classic for a lot of teenagers.
Very common.
Yep.
Mhm.
And
It's
you guys are all welcome to unmute and chime in if you'd like.
Yeah,
Please.
definitely. We want your interaction, or put it in the chat if you're not comfortable unmuting.
So did anybody catch, what kind of things did I use to talk with her about there? What kind of statements? Did you catch some of the questions? And yeah, I don't know if you noticed too, I goofed. I had a couple of closed questions in there also, where I said yes and no. And Miranda did quite right. I said, so are you interested? And Miranda said, no. I'm like, well, no, that's the correct response. Yep, no, I'm not interested. And so I didn't give her, I gave her the opening to get out of the door without a longer winded answer. And so she was good at shutting me down. And I thought that was a good thing. So I tried to rework it, came back at it at a different angle, and said, so what do you really mean by, I can't remember what it was, Miranda. Do you remember how we asked that? The question was, like, what do you mean? Like, you're just going to take care of it. So you gave me a little bit of a little bit of a piece.
Yes, just deal with it. I said, deal with it.
I'll just deal with it. Yeah. So I tried to come back with an open question, like, what do you mean by that? What does that sound like? And you want to be, you get so much more from open questions.
Yes.
A couple people have noted in the chat box there that I asked permission. I think that is one of the most, when I started doing that, I don't know, do you guys do that? Have you guys gotten in the habit of doing that? I'm doing it as part of an elicit, provide, elicit cycle. When we were doing that, I was like asking her if it was okay if I could give her something, and then give her some information, gave the information, and then asked a response. So that's an elicit, provide, elicit cycle. And you want to try to do small pieces of that. We can talk more about that. But I think that asking permission is one of the coolest responses that you can that you get from patients. They're like, why did they just?
And it takes their guard down, I think.
Oh my gosh, they just don't even know what to do with it at first. I love it. And they they just really, it takes them aback for a little bit. So does anybody else have any experience with asking permission?
I love Susie said asking permission allows the patient to feel more in control and most likely more open to explore. That's a good statement.
Yeah. The other thing, has anybody had anybody say, no, I don't want to know? I mean, I have had patients say like, yeah, I'm not really interested.
I have never had anybody say no.
Dr. Cross said
maybe
yes.
once or twice. It so rarely occurs. I'm like, oh, okay. But I think it only happened a couple of times. It really, it takes you aback, but you have to respect it. And it also gives you information. It's like one of those things like where you really miss, you're like, oh, they're not ready for this discussion yet. It's just at least let you know where they are, that that also, I think it's also an opportunity for a reflection of like, well, it sounds like you're really defensive about this, or I don't know if I go that strong, but it's it sounds like a really hot button issue potentially, or something that really is concerning. So anyway, so I think you get a lot of information, but you do have to respect it if they say, no, I don't want to do that. There was one chat in the chat question about like how we started a phrase, what I'm hearing from you.
Yes.
Yeah. So this is from Sky. So Sky writes in here, what I'm hearing from you is, and then asking to elaborate the correctness of what she said. This can allow you to get more details or accurate as well. And that's true. I also think, I'm always saying to people when we're learning reflective statements, be easy on yourself. Give yourself some grace. It's not automatic at first. And you're going to find yourself using phrases at the beginning that sound like, well, what I'm hearing you say, or it sounds like blah. That's totally fine. You're going to get into a rhythm with reflective statements where they sound more conversational, and they're going to sound like things that would come out of your mouth. I think a lot of times, we'll get into this discussion and you're using a lot of, it sounds like this, or it sounds like, and you're thinking, oh my gosh, I sound terrible asking this. Where really you'll get more and more comfortable as time goes by. It's just practice. I always say to learners when you're doing reflective statements, think back to that very first clinical encounter you had in medical school or in PA school or in nurse practitioning, where you're going in there and you're just like, I don't even know how to start this interaction. You're very nervous about it. Reflective statements are going to be the same way, and then you'll get the hang of it.
Yeah, and you can practice on your family too.
Exactly. Exactly.
All right. Well, perfect. Well, what we're going to do, so we are recording these for a podcast, so we're going to take a short break, and I'm going to turn it over to Jesse for that short break, and then we're going to come right back into the second session.
All right, everybody. This concludes session A of episode 9. If you're joining us live, don't go anywhere. We're continuing immediately. If you're joining us via podcast, session B of episode 9 is available wherever you listen, whenever you're ready to listen. Okay, welcome back, everyone. This is session B of episode 9 of Project Echo for Pediatric Obesity. Today's episode is entitled Practical Motivational Interviewing Strategies. I will provide a link before the end of the meeting today so that you can access this episode and previous episodes on CAMC's Learning Network system. All right, Miranda, it's all yours.
All right, thank you. And actually it's Talent LMS, which is with West Virginia Health Connection, but we will explain that at the end. So, but yeah, I'm really happy to have Dr. Chris Bolling here with me. He's a pediatrician from Kentucky, and we are talking about motivational interviewing. And we just went over some concepts about how to do motivational interviewing, and we are now practicing. So we're going to go to our second case. And we would like to have a volunteer for this case. So if there's somebody that would like to volunteer, if you can either raise your hand or put it in the chat that you're willing to be a volunteer with Dr. Bolling.
And the role you're going to be playing is a 10-year-old who's unwilling to eat fruits and vegetables.
Do we have a volunteer? Jesse, can I volunteer you?
Me?
Yes.
Sure. Okay. I am a 10-year-old patient unwilling to eat fruits and vegetables.
Correct.
Okay.
So hi, Jesse. It's good to see you.
Hi, Dr. Bolling.
How's 4th grade going?
It's all right. Sometimes.
Fourth grade's an interesting year. That's really a tough year. I always think most of my patients will always tell me that they like 4th grade because it starts getting more interesting. Have you found that to be the case yet?
I mean, sometimes like we got to do some experiments in science class this year.
Yeah. It's like you're not waiting for everybody to learn to read anymore. It's like you're really reading to learn now. That's cool. So Jesse, last time we were talking, your mom brought up with me like that you really, really don't like fruits and vegetables.
Yeah, no, I don't.
Can you tell me more about that?
I don't know. I just don't like them. Like, I don't like the way they taste, and I don't like that I have to like wash them and stuff.
Okay. So why do you think people are on you all the time about eating fruits and vegetables?
I don't know. Maybe, I guess they're supposed to be good for you.
Mm-hmm.
And I don't really like them, so I never have them.
So on one hand, you kind of know that like you don't like them, and that's you don't like them. But on the other hand, you're kind of like, well, I guess there must be something good about them because people are always on me about trying them all the time. What would you say is the biggest issue with it? You know, some of my patients will tell me that it's the texture. Some people say it's the taste. Some my patients will tell me it's just like, I don't like the way they look. What are your thoughts?
I don't know. I like texture. Like sometimes you get like a blueberry and like it's really squishy or like
gross, isn't it?
Yeah, or sour and sometimes like there's a stem on it or something still and you're not paying attention and
you feel like you bite a piece of wood in your mouth, then yeah, that can be kind of gross.
Yeah.
You know, the other thing is too, like sometimes berries are like, you know, they're not ready, then too late. You know, they're kind of hard to gauge sometimes. I get it. So, you know, one of the things that, can I give you some thoughts on what we sometimes do, like as you're getting older, some things that we'll try with patients?
I guess.
Okay. So do you watch any cooking shows?
Sometimes with my mom.
Okay. Do you like those?
Yeah.
So one of the things, I don't know if you noticed this with cooking shows, is they'll do a couple of things, like sometimes, and sometimes your taste buds just change as you get older too. But sometimes on cooking shows, what you'll notice is they'll do things like they'll add acid, like you mentioned that science experiment, like they'll add acid, like lemon juice, or they'll add vinegar to it, and it changes the vegetable. And then other times they'll do things like they'll cook them at really high heat, where they'll do this thing called caramelizing, where they release sugars and they taste totally different. What are your thoughts? Have you seen any of that?
Yeah, like I've seen them like bake broccoli and like it gets crispy, or like they'll add lemon juice to something when they're like sauteing it or whatever it's called.
You had mentioned something about the texture of being an issue for you. What are your preferences? What do you like more with texture? Like, are you more into crunchy or chewy, or what
I
do you
like crunchy.
Yeah, me too. I am not a fan of raw broccoli. I like it when it's roasted and crispy. So that's really cool. So let me, so it sounds like you are like open to maybe thinking about different ways of preparing things, that maybe that would be helpful.
Yeah, I like to cook.
That's good. Good. So cooking might be helpful. So let me ask a question of you. So how important, if we were going to say like 0 is, it is not important at all for my body for me to eat fruits and vegetables, and 10 is, this is one of the most important things in the world for me to eat fruits and vegetables, where would you say, how important is it for you to eat fruits and vegetables?
3.
So not very important. It sounds like it might be of a little bit. Why would you say it's not a 2?
I guess if it wasn't important at all, people wouldn't bring it up all the time.
So just the fact that people would bring it up a lot. So why is it not a 5?
I don't really get it. I play soccer and basketball, and like I'm really active. I play outside a lot, so I don't really see why it matters what I'm eating.
So that makes a lot of sense. So on one hand, you're saying like everybody's on me for some reason, but on the other reason, you don't quite yet see why it's important to your physical performance in soccer.
Yeah, and everybody eats like this. Like my mom doesn't like vegetables that much either.
And that makes a big difference. You know, one of the things you said was that it's like, it's something, it takes something to prepare it too. You had mentioned that also. Tell me a little bit more about that.
I don't know, like if I want chips, I can just go grab chips.
They're ready.
Out of the pantry, yeah. Or I can put like a pizza pocket in the microwave if I'm tired or it's late, because like we get back from sports practice really late sometimes. Like if we have away games, it's like 10 o'clock at night. I don't have time to like.
And you were mentioning you have to wash them too.
Yeah.
Yeah. So let me ask the question a little bit differently here. Like, so let's say that you had decided, like you've decided that you do want to eat more fruits and vegetables. I'm going to ask the question a little differently now. So if you are now 0 is, Dr. Bolling, there is no way I can do this. I can't, there's no way I can eat more fruits and vegetables. I guess it's important, but there's just no way I can possibly do it. And 10 is, if I wanted to do it, I could do it. It would be super easy to do it. So where would you put it on the scale of 0 to 10, where 0 being like, it's really difficult, almost impossible for me to do it, and 10 being like, oh, this is really easy for me to do it?
7, like I could do it if I needed to.
Well, that's really good. That's really, so why not a 5 on that one? Why is it a 7 and not a 5?
I don't know. I guess it's just like, if it's something that I have to do, it's not hard. It's not like that hard. I mean, I could do it if I had to or wanted to.
Kind of like you were saying, like you can you can microwave a pizza pocket. So yeah, you could prepare, and you watch cooking shows, you could prepare it if you needed to. That's really good to hear. Why is it not a 9?
I mean, it's still like a lot of work.
Mm-hmm.
No, I don't know if I could do it every day,
Mm-hmm.
but like some days, like maybe on Saturday when I don't have games, or on Tuesday nights when I don't have practice, I could do it.
So some days are just busier than others.
Yeah.
Yeah. And you're not alone. That happens to a lot of folks. Okay. All right. Let's cut it off right there. That was excellent, Jessie.
Thanks. I spend a lot of time around kids.
Round of applause. Yeah. Excellent. So let's talk a little bit about what happened there, because there was a lot that happened there, a whole lot. So we had a couple of elicit, provide, elicit things in there. We went ahead and asked permission again. We had some reflective statements, some open questions. But let's drill in to, like Dr. Jeffrey was saying, let's talk about this readiness ruler. So first off, with the readiness ruler, there's a lot that you can do with this. So number one, if you notice, this is a little thing. We'll start this up and just kind of get it out of the way. I started 0. You'll hear some people will start at 1 and go 1 to 10. I started 0 because I think it's important to say, like, you can have zero motivation on something. So I like 0 to 10. You'll find some people who are 1 to 10. I like 0 to 10. It just gives them room. And you'll have kept some people say half. The other thing that is always amazing to me, if you've done the readiness ruler, you can do this with first graders and kindergartners. Sometimes it cracks me up how they can figure this one out. I'm always like, oh, you can't. First time, I'm like, you can't do this with them. I'm like, hey, rock it. Try it. You'll have some of those first and second graders who absolutely know what's going on. I think they know the pain scale or something, but they know this 0 to 10 scale. For some unknown reason to me, it just amazes me how quickly they can figure it out. But then the other thing that's the first big thing, so those are 2 little pieces about it. The first big thing, you notice I asked, I've heard people say, like, how ready are you on a scale from 0 to 10? I don't know what that means. I have to split it into 2 aspects. I have to split it into importance, and I have to split it into confidence. And those are different things. Like you noticed with Jessie, and I thought that was fantastic the way she did it. She did sort of the opposite of where I was. We have not practiced this. She went in a completely opposite direction of the way I thought she was going to go. And it was great. So what we learned about her was, it's not an issue that she can't do it. She's willing to do it. I mean, she knows, she watches cooking shows. She knows about, adding vinegar and lemon juice. She knows about roasting.
She knows how to saute.
She's got a strategy together. She knows how to do it. But the issue is, she just doesn't think it's important.
I don't want to.
So, yeah, so that's a really big piece to know about Jessie. It's like, I'm going to have to spend time helping this soccer player understand how fruits and vegetables can be really helpful to her game. So that's where I need to go. I can give her recipes all day long. She doesn't need that. She already knows that. She's already motivated for that. What she needs is an aha moment, like, this is going to make me stronger on the court or on the pitch. So that's one piece, is like importance. Yeah, I feel like you have to do importance and confidence apart from each other. Because if you say, are you ready? It could be either or. Like, I don't think it's important, or I don't know what to do. You need both.
Yeah, I think that's really good too.
The other thing with it that I think is really critical is that going on either side of what they give you. If you'll notice, and again, she gave me a 3 on importance, which was really good. That allowed me, like, okay, it's not very important, but I'm going to try to get her to argue for change here. I'm going to say, why wasn't it a 2 or a 1? And sometimes they give you a 1 and you say, why isn't it a half? So you want them, what you're trying to do by undershooting. I think we're all really good at like, okay, what's keeping you back? What's keeping you back? Let's explore the barriers. Like, why isn't it a 7? Why isn't it an 8? Let's talk about barriers. When really, when you think about it, if you say like, let's shoot under, why isn't it lower? You get the client, you get the patient to say, well, it must be important for some reason because everybody's telling me to do it. So I think that there's some real utility in not forgetting to shoot under. So if you go under, you're going to get them arguing for why it's important. So now let's move over to the confidence piece. So again, when she said it's a 7, I said, why is it not a 5? And it got her to say, well, it's really not that hard. I know what to do. I know how to cook. So that's really helpful as well. If I were to go over, it's still important to explore barriers. Maybe she'll say, you know what, I don't have a good cookbook, or I don't have this or that, in which case that's something we can help with. It's just more information. In general, this isn't a validated scale. This is not something that we're going to like always say, but in general, if a patient says that they're a 7 or an 8, you're probably moving toward the planning phase. You're probably moving toward like, hey, we got a 7 or 8 on importance. We got a 7 or 8 on confidence. Let's start implementing something. So in general, like I once had at an AAP meeting. I don't know if you were there, Jamie, or not. It was an AAP meeting, and somebody raised their hand. They said, "So is that 7 validated?" I said, "Of course it's not. Validated at all. It's just it's not." So, but in general, people are in that range. They're ready for the next step.
Yeah.
Okay. Any questions?
Right.
I did a lot.
Anybody have any questions or comments?
I did a whole lot of yakking.
I bring that out in people. What can I say?
But it's really fun.
Right.
I love the readiness ruler.
Yeah, Dr. Jeffrey does too. All right. Do we have a volunteer for case 3?
Come on, we've got to have a brave soul out there somewhere.
Just when you're going to be a 15-year-old who is vaping.
That's easy. You can be a 15-year-old who's vaping.
I can do it.
Yeah.
Okay. All right.
All right. Is that Lakin?
Perfect.
Is that right?
Yes. Yep, that's right.
Okay, Lakin, thank you for doing this.
Yeah.
So
No problem.
Lakin, hi, it's good to see you. Thanks for coming in today.
Yep. Thanks for having me here.
So Lakin, now that we've had your mom step out of the room, we always ask you a couple questions of our teens. Are you a sophomore or junior this year?
I'm a sophomore.
Cool. And what school do you go to?
I go to my local high school, Morgantown High.
Okay. I love Morgantown. So that's really cool. Sophomore year, that's a busy year. So now that your mom's out of here, we always have to ask you some questions about things. So do you use any tobacco, marijuana, or nicotine containing products?
Well, I guess I vape, so I don't know if that really fits under that.
It can, yeah. It depends, but most vape products actually do have a fair amount of nicotine in them. So how often would you say you wind up vaping?
I don't know. Usually I hang out with my friends after school, so probably just on the weekdays.
So it's a social activity for you.
Yeah, I mean, all my friends do it, so I just do it to hang out with them, and they said it's not as bad as smoking cigarettes, so I don't see any harm in it.
So it sounds like you're concerned because some people feel like it's harmful. Some people who know you do this have told you it's harmful, I assume, and then on the other hand, you feel like there's not really a problem with it because it's safer than smoking.
Yeah, I mean, my mom always stresses about not smoking. There's history of lung disease in my family, but she doesn't really get it. Vaping is totally different from smoking.
Can I give you some thoughts on vaping?
Yeah, sure.
So one of the things that we know about vaping is that the nicotine content can be really, really high in things that people vape. And there are a lot of people that actually really get hooked on it. What are your thoughts on that?
I didn't really know that there was a high amount of nicotine in them. I don't think that I'm hooked on them though. I think I could probably stop whenever I wanted.
Mhm. There was one other thing I was wondering if I could mention to you. You mentioned lung disease. Could I mention something else to you?
Yeah.
So this was something that kind of happened before the pandemic. I don't know if you remember this or not, but there were a lot of cases of people getting a really kind of scary sort of lung process from one of the agents that was in vaping products. They're not very well regulated in some regards, and some of the flavors and some of the stabilizers in them, we think can cause pretty significant lung damage.
Okay. So basically that's why my favorite flavors got taken out of the stores.
Yeah, that's that, and also too, because a lot of times the manufacturers are trying to they put a lot of flavors in there that are enticing to real young kids, so they get kind of hooked on them.
Okay. So are the ones that aren't super flavorful better for you?
So not really. Generally, they still have pretty high nicotine content to them, and they still, again, it's not only the flavor, sometimes it's the stabilizers or other things that we think can cause some lung injury.
Okay, that makes sense.
Mm-hmm. Mm-hmm. Okay, so well, thank you so much, Lakin. That was very helpful. Yep. So a couple of thoughts there. One of the things that have used a couple of times here was one particular type of a reflective statement called I'm completely blocking right now, where we're doing a double-sided reflection, where if you notice, we'll do a reflection where we say, on one hand, you're saying that like, I really enjoy vaping, but on the other hand, I hear you saying that people are really telling you that vaping is not good for me. So what you're doing is you're taking two statements. You're trying to take a statement that Lakin gave me. I'm trying to take a statement she gave me and trying to reflect two things. Generally, you're trying to reflect the more positive behavior change at the end. So, for example, it would be things like if we were talking back with Jesse about fruits and vegetables. On one hand, I think we did this one. On one hand, Jesse, you're saying that fruits and vegetables, you don't like the taste of them, but on the other hand, you're questioning that, that there might be something that would make me a better soccer player with them. So what you're trying to do, and somebody said this exactly, you're trying to create the discrepancy and kind of allow them to sort of sit with it and kind of give you their thoughts around it. And sometimes you'll get people to start arguing for change. Like Lakin was being great. She even sort of like started making a little bit of the connections for us there, where she was saying, so you're telling me that this is like potentially could be something I get hooked on, or this is something that could cause lung injury for me, like smoking could. So basically, it's just a quick little way of sort of creating like this discrepancy. And I know we're coming down on time here too, but the other thing I was going to mention was those elicit provide elicits cycles are really helpful for allowing us to do what we want to do, which is give information. You're not giving it as advice. You're not telling them what to do, but you're bracketing this piece of information that we want to give them with permission beforehand, a piece of information, and then asking for a response to it. So anyway, so I know we're coming on down to time, so I want to leave time for questions there too.
Okay. Yeah, thank you. Does anybody have any questions as we do wrap up? I did want to just say, so this is our last Project Echo episode for this year. We are going to take a break for November and December. You can view all previous Echo episodes on West Virginia Health Connections Learning Management Platform. It's called Talent LMS. There is a link. You just need to go to that link and sign up, and you can get access to all the recordings. Okay. Yeah, thank you, Lakin, for providing that. So yeah, if anybody, and then we ask that you do fill out the evaluation survey link so that we can know how we can improve. If you have any questions, you can put them in the chat or you can unmute yourself.
I just have one comment that, and Dr. Bolling, you can tell me how you think this is. In the resident teaching clinic, what I try to do is anybody new to motivational interviewing to kind of break it up. And like motivational interviewing 101 is just asking permission, and just start asking permission. Can I show you the growth chart? Can I go ahead and tell you what shots Johnny needs today? Can we talk about what he's eating? Just asking permission, just practicing asking permission about anything so that it just becomes part of your style. Get that down first, and then move on to motivational interviewing 102, which is the reflective statements and then creating discrepancy with the two-sided coin. And as far as anybody that's new to motivational interviewing, I found that helpful in training.
I think that's a great point, Jamie. That's a really, that's a great, and it's a game changer. I think you get the positive reinforcement as a learner, like, oh boy, this asking permission really makes a difference. And I think, working on consciously thinking about those open questions is also a good early step. Again, it's just baby steps. I've often heard that when you're actively talking about behavior change, if you're going to use open questions, you should strive for a ratio of 4-to-1, which is really hard. It's really hard, really hard, but it's a good little, those are good little things. I think asking permission is a great way to start.
Yeah, Dr. Bolling, do you want to go over where they can access resources for motivational interviewing?
Absolutely. So I kind of mentioned that Miller and Rolnick text. It's sort of the Bible. There's another one out there by a guy named Rick Botello that's called Motivational Practice, which is good. I also, if you want to take a course, I once took a course to the University of Minnesota Summer Public Health Institute, and you'll find these courses around that are, if you go to motivationalinterviewing.org, you'll find things that are out there. Someone mentioned that they did Change Talk, which is kind of fun that that's still out there. That's a pediatric obesity specific app that you can get on your phone called Change Talk. It's from a company called Cognito. There are actually a few new ones in there that actually look at, it's been updated to include some stuff on childhood feeding. So it's sort of closely related. So that's one that's still out there. We've gotten a lot of mileage out of that one. But also to look around, these things will show up in different places in the community we find. I'll see them all the time in greater Cincinnati where, this place or that place is having you do, and motivational interviewing is motivational interviewing. You try it, we've done it with HIV/AIDS service agencies. I've done it with a training with a homeless runaway shelter here in Cincinnati. So it shows up in a lot of different spots, and it's just kind of fun.
Awesome.
All right.
Does anybody have any questions? We're almost out of time. We have 1 minute.
And feel free to contact me at any time.
Yes. There's your email in the chat, Dr.
It
Bolling.
should be. I will put it in there before we go off.
Thank you so much for being here, Dr. Bolling, today. We really appreciate you.
My pleasure.
Thank you. All right, Jesse.
On that note, thank you all so much for joining us today. Once again, this is the final episode of Project Echo for Pediatric Obesity for the year 2022, but we will be back in 2023 with more great episodes for you. You can access previous episodes at the link that I just dropped in the chat, and we'd really appreciate it if you took our evaluation survey, which is also available in the chat. And on that note, I'm going to just go ahead and let the lovely 5210 song take us out. So here.
5210, every kid, every day. Let's have fun the healthy way. 1, 2, 3, 4, 5 servings of fruit and veggies are great to eat. 1-2 hours of playtime or less on our screens is more than plenty. And let's go play outside. 1 hour! Tiger it, my turn to hide. 0 sugary drinks. Yeah, that's the healthy way to think. Every kid, every day. Let's have fun the healthy way. Every kid, every day. Let's have fun the healthy way. 5210.
All right. Bye. Bye, everybody.
Thanks.